something is off, you start to look for information, you start to try to Google your symptoms. Is this normal for me to feel this way? Is there something wrong with me? It's difficult. These are all difficult questions that you have to balance and deal with. The truth is, that's the first step. You have to realize that something's off. You've made the commitment to look for information. Now we have to make sure that we get the correct information and that we move forward in the right direction. Can you boost testosterone naturally? Yes, but probably not in the way you're thinking. So when we talk about boosting testosterone through lifestyle changes, exercise, proper nutrition with your diet, yes, we can increase your points a bit on your blood levels, right? So, let's say your total testosterone is 300 when you run the test. We make these lifestyle changes. We kind of make the effort to try to push the needle in the right direction, and we can probably get maybe to 330, 340, 350. Now, the question is, are you still going to have symptoms or not at that range? And then to figure that out, we need to just kind of break it down to what is the root cause of your low testosterone. So there's primary hypogonadism and secondary hypogonadism. So primary, to keep it short and simple, is basically a defect in your testicles to produce the testosterone. Secondary is a defect up at the level of the brain, your pituitary sending the signal to make the testicles make the testosterone. So either way, if we have primary or secondary, your body is just physically incapable of making adequate levels of testosterone. So that's why it flutters and you have lower levels, and it gets to a point where it becomes symptomatic. Side effects that we feel from having the low testosterone, which can be a lack of motivation, lack of energy, fatigue. We notice that we can't keep up at the gym. We're just not recovering the same way. We're having difficulty losing those few extra pounds when we try to work out to do that. We may become a little bit irritable. We're just kind of annoyed at things that we normally wouldn't be annoyed at. And those are all the symptoms that you feel when the testosterone levels are low. Can we improve that with exercise? Sure, we can increase our numbers a little bit, but not to the point where we're going to overcome those symptoms that we're feeling. The only way we can adequately do that is by actually giving ourselves the testosterone that we need to get to those levels that are optimized so that we can push past those symptoms and feel better. When we start to feel these symptoms of low testosterone, but we're not really sure whether it's not low testosterone, we haven't done any blood work, we're just kind of starting to figure this out. What are some small changes that you can make that are going to help you out? So, first and foremost, we need to move. Our bodies need to physically move. So we need to be active. We need to be in a gym. We need to be doing some kind of resistance training, as well as cardiovascular training. So the point is that we do need to exercise. We need to shoot to do at least 3 times a week, a physical routine, get the heart rate elevated, resistance training to make our muscles actually work. And that's step 1. Step 2 is your nutrition, right? Diet needs to be on point. So what I mean by that is we need to try to eat clean, eat healthy, focus on our proteins, make sure we're getting our healthy fats, make sure that we're hydrating adequately. Water is very important. We kind of overlook the water. Avoiding foods that we shouldn't be eating, which is the processed sugars. Alcohol is a big one. We can have a social drink here and there. It's not that you can't drink, but we shouldn't be drinking every day, at least not if you're trying to optimize your hormone levels and the way you feel. And another one that's highly overlooked is sleep. So we do need to make sure that we get adequate sleep, and it's got to be a restful sleep. So we got to pay attention to our sleep patterns and when we're getting to bed, how many hours of sleep we're getting, and the quality of sleep that we're getting in that time that we're sleeping. Before you go out and buy another test booster, consider buying a natural test booster. What you need to understand is that it may not move the needle in the direction that you think it will, right? So again, it can kind of boost a little bit the numbers, nothing substantially that's going to get you to symptom resolution. At the bottom line, at the end of the day, if your testosterone level is deficient, your body cannot produce the testosterone level, we need to replace that testosterone level. That is in combination to the diet, exercise, and lifestyle changes, which we have to do to meet the medication halfway, but we just have to replace the testosterone. There is no way around it. If it's deficient, it needs to be replaced. So lifestyle can either support your hormone treatment or work against it. And what I mean by that is, we're kind of at a crossroads. We're either physically active, trying to do the right things, but realizing that we just don't have the gas in the tank to get there, or we've completely let ourselves go and we've had that hard realization that we're nowhere near the person that we should be. So lifestyle is going to make that difference. If you're already doing the right things, doing the exercise, eating right, sleeping, and you're just not getting the results you need, then you're ready to start the testosterone replacement treatment. And it's going to give you the boost that you need together with your lifestyle choices to get you to the right place. If you're on the latter end of it and you've just had this realization that you've let yourself go and you're in a spot in your life that you just don't even recognize the person you see in the mirror, you need to have a hard realization that you're going to have to put the work in, right? Injecting testosterone and continuing those poor lifestyle decisions that got you to that point isn't going to help you. We're not going to see the benefits that you should see from testosterone. So if you think, testosterone is deficient, I can just inject it and I'm fine. I can continue to eat shit food and drink 6 beers a day and just sleep an hour a day. You're honestly wasting your time and your money because you're not going to get anything out of that testosterone treatment. You're going to fall into the category of guys that say, hey, this is crap. It doesn't work. It takes the time and the effort and the commitment and consistency to make it work the way it should work. And if that's who you are, you're absolutely right. Testosterone isn't going to work for you because it's supposed to work with you. So one of the biggest myths about TRT is that it's just for guys who want to build muscles in the gym. It's so much more than that. TRT is crucial, not only for men, but for women as well, in mood stability, energy, motivation, drive. It's going to affect your interpersonal relationships with other people, with yourself, with your views on life, your perspective, your way of thinking. It's going to balance and complete you in so many more ways than just in the gym or doing exercise or lifting weights. My patients don't come to me complaining that they want bigger biceps or bigger glutes. They come to me saying, something's wrong. I don't feel like myself and I need you to help me. We can all agree that over the years, testosterone has been abused and misused, has gotten a bad rap because of that. But it can be life-changing and improve your life significantly for the better when it's done under the right care and the right protocol. It is something simple. Testosterone is deficient and we need to replace that deficiency. And that's where some of the misconception comes in. I can just get my testosterone anywhere. What do I need a provider for? I can buy it off the internet. I can just inject myself testosterone. That's no big deal. I can go on Google, ask ChatGPT, and it's going to tell me what dose I should use. And that's where the misconception comes in. Testosterone replacement is a nuance. It's an art. It's very individualized to each and every person. So we're not just looking at testosterone. We're looking at a combination of labs that are painting a picture that we combine with the personal symptoms that that patient is feeling so that we can come to a dose that is actually working for this patient. Too little testosterone and you're still symptomatic, you're still having problems. Too much testosterone, you're going to have symptoms on the other end of the spectrum. So it's very important to actually understand what you're doing, have somebody that's guiding you in the right direction and giving you sound advice that's based on experience, knowledge, and backed by science and research so that we understand that we're making the right changes and not just blasting something because we know it's good and we know we need it, so let's just blast it. Coming to the realization that something is off or something is wrong, you start to have your doubts, you start to look for information, you start to try to Google your symptoms, get some information and try to understand what's happening. It's difficult, it's not easy. You're trying to figure out, is this normal for me to feel this way? Is it not normal for me to feel this way? Is it just because I'm getting older? Is it just because I'm not sleeping because of stress? Is there something wrong with me? Am I less of a man? Am I less of a woman? Am I not the person I thought I was? These are all difficult questions that you have to balance and deal with. And the truth is, that's the first step. You have to realize that something's off. You've made the commitment to look for information. Now we have to make sure that we get the correct information and that we move forward in the right direction, right? So once you decide, hey, maybe there is something, that seed of doubt is planted, that maybe your levels are low, maybe you would benefit from some treatment. First step is to get some blood work done. I mean, honestly, we need to know what your levels are at a baseline. Combine that with your symptoms. Talk to somebody who truly understands the effects of having a hormone imbalance so that they can use those numbers and your symptoms to guide you in the direction and help you feel confident in your decision of moving forward with treatment. Treatment's not for everybody. It would make everybody a better person, a better version of themselves, but hey, it's your choice if you want to treat yourself or not treat yourself. But to be able to be happy and content with that decision and live with that decision, either way, whether you decide to treat or not treat, is the important part. You made an educated decision based on the facts, and now you can live with your decision. So tadalafil, what is it? Most people know it as a erectile dysfunction medication, right? And why is that? To begin with, that's how they marketed the medication. So they wanted you to think that. And that's just to tie into sales and marketing, right? Sex sells. So erectile dysfunction, pill, problem solved. And that's why people think that way. But in reality, tadalafil was actually developed as a blood pressure medication because of its natural abilities to smooth and increase blood flow. So that's where it was developed as a blood pressure medication. Coincidentally, as a side effect, they realized, hey, it helps with erectile dysfunction. And that's what they decided to market it as. Are there more benefits to tadalafil than just erectile dysfunction? Absolutely. And we can use that even for men who don't have erectile dysfunction. We have improved blood flow, improved cardiovascular health, improved gains in the gym, improved prostate health, all because of the actions of this medication. So tadalafil can be done in higher doses, which is directed specifically for erectile dysfunction, or we have what's called low dose daily Cialis, where we can take a low dose of tadalafil, usually somewhere between 2.5 to 5 milligrams, sometimes maybe as high as 10 milligrams, and we take that daily. So it's always on standby, always in the body, always exerting, and that's why we get those benefits. Improved urinary symptoms, so we're not getting up at night as much to go urinate. We're not having issues with urine flow. It's going to help in the gym with the pumps, right? There's more blood flow to the muscles. We get a bigger pump, a better pump in the gym. Testosterone replacement helps more red blood cell production, more oxygen in the blood. There's more blood flow. So now we're getting more oxygen to the muscles. We have a better recovery in the gym, all from a medication most people think is erectile dysfunction.